Hello and welcome once more to the Bench Report, where we discuss recent debates from the benches of the UK Parliament. A new topic every episode. You're listening to Amy and Ivan. So this week we're looking at a crucial debate that was sparked by a heartbreaking story from a constituent.
It's about the mental health crisis facing people with terminal illnesses.
Exactly. The catalyst was a man named Mike who shared the story of his late wife, Sarah. She was diagnosed with lung cancer back in 2017.
And what Mike described was, well, it was a profound decline, not just from the cancer itself, but from a complete lack of psychological support.
He said this vibrant, outgoing woman became, in his words, a shell of her former self, crying daily, unable to even read or eat. It really paints a picture of this mental health trap door that opens with a diagnosis.
And Sarah's story, sadly, isn't an isolated one. The numbers brought up in Parliament show that what Mike experienced is happening across the country.
What are those numbers?
Well, officially, 17% of cancer patients are diagnosed with depression or anxiety. But the shocking part is that nearly half of them will never get the treatment they actually need.
And the debate highlighted the reasons why, didn't it? It seems to be a twofold problem.
It is. First, you have the waiting lists. They can run into months, which is just an impossible time frame when you're terminally ill.
And second, even when support is offered, it can be completely inappropriate.
Massively. I mean, Sarah was told to read a leaflet or to try gardening.
Despite being too physically unwell to do either, it just illustrates this huge disconnect, this failure at the clinical level.
It points to a very specific gap. What's needed is a psycho-oncologist, a specialist who understands the mental health toll of a cancer diagnosis.
And Sarah's local hospital did have one, but they were
completely overstretched, which just reinforces the point. You can't have one specialist covering thousands of patients. It's not a workable system.
So this all widens out then from an individual clinical failure to a much bigger systemic one. It's about how we fund end-of-life care.
It is. The phrase that kept coming up was postcode lottery.
Meaning, your access to support depends entirely on the financial health of your local hospice, not your clinical need.
Precisely. We heard some alarming evidence on this. Hospices like Weldmar are facing deficits of nearly £1 million.
And forget me, not hospice had to cut 800 treatment spaces.
Which has a disproportionate impact on poorer communities. The funding shortfall hits them the hardest.
So what did Mike and the other MPs propose as a solution? What has to change?
They laid out some very clear steps. First, an immediate mental health assessment the moment a terminal diagnosis is given, a baseline.
Okay, that makes sense.
Then, a clear, properly funded pathway to a psycho-oncologist. And finally, and this is the big one, a sustainable long-term funding model for hospices to end that postcode lottery for good.
And what was the government's response to this?
The minister spoke about a commitment to move more care into the community. There's also a new palliative and end-of-life care framework due this spring.
They also mentioned new investment, didn't they?
They did. An extra $688 million in cash terms for mental health, and the recruitment of almost 7,000 new mental health workers since mid-2024.
But I suppose the question is whether general mental health recruitment solves a crisis of specialist access. If hospice is still cutting services, it doesn't matter if care is in the community because the services aren't there.
That's the core of it. And you also have to remember the family. It's not just the patient who goes through this.
No, the whole family unit is on that journey.
Exactly. Unpaid carers, loved ones, they suffer an immense emotional toll. There was talk of a potential 247 palliative care helpline, which would be a vital support for them.
And what really puts the urgency of all this into sharp focus for me is a statistic we heard.
That over 10% of all UK suicides are linked to chronic or terminal physical illnesses.
10%. When you hear that, you realize this isn't an optional extra.
Not at all. It underscores why this psychological care must be built into palliative care from day one. It can't be an add-on or a reaction to a crisis. It's the only way to really honor the lives of people like Sarah.
Hello there, this is Tom, the producer of The Bench Report. Listener suggestions are vital to my mission of making politics more accessible and accountable. So, if you have an issue that's really important to you, personally or professionally, and want to know what those in power are doing about it, please get in touch via email or via our socials at Bench Report UK. I'll grab another coffee and start scanning those parliamentary archives.